Good morning, everyone. I see we still have some people joining, but we'll get started in the interest of time. Thank you so much for joining us for our Grand Itasca Foundation Virtual Breakfast Club. My name is Cassie Schnowski and I'll be your host today. So before I introduce our first speaker, just a couple items of housekeeping. We have about 20 to 25 minutes of presentation and then lots of time for questions and answers at the end. So for those who are able to join us via Zoom, please use the chat feature to send in a question. And then those who are on the phone, I'll give you my email address as an easy way to send a question if you have one. It is cchrZan1@fairview.org. And you're also able to reply to any of the invite emails and you'll get to the same place. And we'll make sure that all questions are addressed at the end of the call. So first up is Jean MacDonell, and she is our president and CEO here at Grand Itasca Clinic and Hospital. And she's going to talk about some of our latest updates here, including our COVID response and other operational changes and updates. And then Kelly Kirwin, our director of Grand Itasca Foundation and Community Relations, will share a real short video and share some foundation project highlights, after which we'll address questions. So Jean, let's get started.
Thank you. As Cassie said, I'm Jean MacDonell. I'm the president and CEO here at Grand Itasca. And for those of you who don't know me, I've been in healthcare for 22 years, 13 of which have been spent here at Grand Itasca in various roles. I grew up in Grand Rapids and graduated from Grand Rapids High School. And I'm proud to work in this community and be part of the team here at Grand Itasca. As many of you know, 2020 has been and continues to be a difficult year for all of us, including healthcare organizations like ours. Back in March, at the start of the pandemic, Grand Itasca, we had to quickly make significant changes to our operations, including ramping up our number of negative airflow rooms to more safely care for COVID patients, and also sourcing personal protective equipment, or PPE. We did a lot of cross-training of staff and unfortunately had to furlough many staff too. At one point, we had 34% of our workforce collecting unemployment, which might seem odd for a healthcare organization during a pandemic, but patients just were not coming in for care for several weeks. In line with statewide recommendations, we canceled all elective surgeries, limited the types of appointments that could be conducted in person, and had to quickly roll out some virtual care options for patients like phone visits and e-visits. And you know, one of the most confusing and I think frustrating things for all of us, but including our staff here at Grand Itasca through this whole pandemic, has just been the unknowns with the virus and having to adapt to the latest information, policies, clinical protocols, infection control guidelines. We really have felt the benefit of our partners at mHealth Fairview and their resources. And we of course continue to rely on the Department of Health and the CDC for information. And despite all those challenges, I'm so proud of the resilience of our staff here. They've really adapted to all of the what feels like daily and sometimes multiple times daily changes in patient flow and recommendations for what kind of masks and PPE we're supposed to be wearing, all while caring for the same number of, and in some cases, more patients than they did prior to COVID. Everything we've done has been to try to keep our staff and our patients safe. Our processes for testing patients for COVID have evolved significantly since the start of the pandemic, when we were only able to test just a very limited patient group, to now when we're testing an average of about 100 patients per day. Since the start of the pandemic, on March 16th, we've collected just over 10,000 COVID tests. Testing supplies are much more readily available now as compared to March, April, and May. We're able to test all people with symptoms and many categories of asymptomatic patients. For example, if a patient has a known exposure to someone who has tested positive for COVID, or if a patient is traveling to a state that requires a negative test in order to enter. Most of our testing has been done curbside, so out in front of the clinic and hospital in the parking lot. And with our early start to winter, we're getting ready to make some changes to that process to protect our staff and patients from the snow and cold. And of our community and patients, I just really can't say enough. Our patients have supported us in so many ways through the pandemic, through patience and grace, and as we had to cancel many procedures and appointments at the start, and then by returning for care as soon as they felt it was safe to do so. There's certainly will continue to be many bumps along the way, but it's clear that our patients trust us to care for them and their families, and for that I am grateful. Many of our metro partners are not experiencing a bounce back in volumes like we are here in rural Minnesota. So while COVID is not, it's most certainly not behind us. In many ways, I think it's more in front of us than it has been all along. We appreciate the immediate and ongoing support that has been offered to us, and just wanted to point out we've received dozens of requests from local businesses offering to buy meals for our staff, hundreds of donated items of PPE and other supplies, and more than 5,000 home-sewn masks from the community. Without the support of this community, I truly don't know how we would have gotten through this. We're also fortunate to have been the recipient of a couple of important local grants throughout the time. First, we received $15,000 towards our foundation's Care to Share fund. And this is our employee crisis grant fund that awards up to $500 to employees experiencing a crisis. And this grant money was dedicated to employees experiencing crisis specific to COVID-19. We also received $20,000 to support efforts of Mask Up Itasca, which is a group of individuals committed to reinforcing and encouraging safe personal practices to combat the spread of COVID in our Itasca County area. The work for that grant included yard signs and posters, social graphics, 2,500 branded Itasca Strong masks for local businesses, supplies for 8,000 children's masks sewn by local volunteers for our local schools, as well as a series of videos urging Itasca area residents to take personal action to limit the spread of COVID-19 and to keep our kids in schools. And speaking of schools, we continue to attend weekly touch points with our local school district and Itasca County Public Health to participate in the discussion related to the pandemic and any trends affecting our 14-day case rate for Itasca County. We also participate in frequent calls with our local and regional healthcare partners to prepare for a potential surge of COVID patients and monitor the number of available hospital beds and other resources that are available. The available hospital beds they've been very limited in our region for the last few weeks, so we are really keeping a close eye on that, and of course are working with our partners at mHealth Fairview on their bed capacities as well. We've been participating in regular press briefings with public health and other healthcare and related agencies. These briefings are attended by local and regional media and cover relevant topics related to COVID. We've intentionally made an effort to be as transparent as possible throughout the pandemic, freely sharing as much information as we can with our patients and the public, and we've had some good feedback with that. That's been well received and appreciated. Despite living in the COVID world for more than 7 months, we certainly don't have it all figured out, that's for sure. We'll continue to evolve our practices as we learn more. We're still making changes to how we're operating and on what seems like a very frequent basis. Just last week, we made a policy that no one will be able to enter the clinic without a mask. Our masking practice has been to request that patients and visitors wear masks, but now we're strictly enforcing it. We still do encounter resistance to masking, so this was an important step for us to take in the interest of protecting our patients receiving care here, and also our staff who are in close contact with patients. We continue to limit visitors to our facilities and adjust this policy as the numbers go up and down in the county. And right now we are allowing in most circumstances 1 visitor per patient. And again, this policy is in place and designed to protect our patients and our staff. And we do understand how difficult this is to not be able to visit a loved one potentially that's in the hospital or a friend who's had a baby. Fortunately, we have been able to offer iPads to patients who want to connect with their friends and family via FaceTime, so that's been a good option. Throughout COVID, we've done a lot of shifting from no visitors to limited visitors, from no surgeries to elective surgeries with COVID test prior, from our staff wearing homemade masks to all of them in procedure masks and others in full PPE all day, every day. And we know it has not been easy for the staff, and it hasn't been easy for the patients either, but we do appreciate the support and understanding and all the patients along the way. So just for a minute, I'd like to shift gears away from COVID, and again, I'm happy to answer any questions at the end. We do have some other announcements to share that we're excited about. We've been very busy in the way of recruiting medical staff to our organization through the pandemic. In the past year, we've hired 2 emergency medicine physicians, 2 rapid clinic providers, 2 family medicine doctors. One is a sports medicine physician, an OBGYN, and a psychiatrist. And as Kelly will talk about in just a minute, we've also expanded our intensive care services with the addition of new Tele-ICU technology connected to mHealth Fairview. We're so happy to add these providers to our medical staff and expand the services offered to patients in the community. Lastly, I'd be remiss if I didn't try to fit in a reminder to get your flu shot. Our campaign for this year's flu shot is, the flu isn't taking this year off, and neither should you. We're offering flu shot only appointments out of our YMCA clinic, which has been closed for primary care since the start of COVID. And you can get an appointment Monday through Friday from 8 to 4:30. And this year more than ever, it really is important to get vaccinated. So I think that's all I have for now. I look forward to any questions you have at the end. Thanks again for joining us today. Kelly, I'll turn it over to you.
Great, thanks, Jean. Can I first just echo the gratitude shared for the support from our community? Wow. Grand Itasca Foundation only exists because of this incredible support from our community, and I have the fun job of sharing these stories every day. So first of all, my name is Kelly Kirwin. I am the Director of Foundation and Community Relations here at Grand Itasca. I've been with Grand Itasca for 12 years, and like Jean, I am also originally from Grand Rapids and a graduate of Grand Rapids High School. I am so proud to work with Jean and the rest of our team here at Grand Itasca. As we all know, this entire organization is invaluable to the region, and I'm very proud of what our teams do every day for this community. In turn, our foundation's story is all about the support that Grand Itasca receives from our community. My job today is to show you that impact. I'd like to start with a quick video that demonstrates this much better than I can even put into words. I am so humbled by this story of giving in our community. Our donors make such a significant impact at Grand Itasca. In the video, you see that we recently raised over $2 million for the Close to Home capital campaign that brought a new cancer clinic and infusion center to Grand Itasca. And I have the wonderful opportunity to hear from so many patients and their families about how grateful they are to be able to receive specialty care so close to home. Here are two of our recent grateful patients who shared their story with us. Today, we want to thank you, our community, for making this happen for patients at Grand Itasca. Your impact is felt every day by so many families in our community. I also want to honor our largest annual fundraising effort, the Burgraff's Ace Hardware Caring for Kids Charity Classic. Typically, this annual event is a really fun day of golf and socializing out at Pekegama Golf Course. But this year, as you may know or suspect, the event was canceled due to COVID. This partnership with Steve and Amber Burgraff of Burgraff's Ace Hardware started 7 years ago. And since its inception, Caring for Kids has raised over $500,000 and has allowed us to literally transform pediatric care here at Grand Itasca. Our favorite part about all of this generosity and support are the kids we serve. We are able to highlight these special patients at the event each year. We call these kiddos our all-stars. They truly are our heroes. In this picture, you see one of our all-stars, Gilbert, with a brand new piece of equipment that was purchased with Caring for Kids dollars just last week. How cute is he? This event has allowed our medical teams access to funding that goes above and beyond their basic needs for care. These dollars allow them to fit equipment specific to the patients that they serve. And every year they are able to reinvest in their department to keep these kids engaged and entertained while they are working so hard during their rehab appointments. We are so proud of what we are able to do with our Caring for Kids funds. Despite a canceled event this year, our community continues to show their support by donating to this fund and by participating in the Roundup program at Burgraff's Ace Hardware. Customers at ACE can round up their purchase to the nearest dollar at checkout. This commitment of pennies by each customer has already raised over $12,000 this year. How incredible is that? So thank you to all of you for rounding up for kids and for your support of this important annual event. Today, I also want to highlight what your donor dollars have been doing since this pandemic started. As you are well aware, much of the world has quickly transformed through COVID, and healthcare is no exception. Grand Itasca has been able to enhance and expand our delivery of care through telemedicine tools. Our foundation was eager to be a part of this telemedicine advancement at Grand Itasca and immediately responded with a $48,000 grant to our ICU department. They quickly purchased two-way audio and video technology, allowing our staff connection to intensive care nurses and physicians at mHealth Fairview Southdale Hospital. What this does is allows our staff here at Grand Itasca access to 24/7 communication with this specialty care team, allowing us to serve more patients with higher acuity needs close to home. This project is exactly what we are all about. We all love living in rural Minnesota, but most of us would not live here without access to high quality care. But in order to keep up with all that we want to do as a medical campus, the philanthropic support from our community is imperative to our work. So on behalf of Grand Itasca Foundation, our medical staff, our leadership team, thank you for your support and your continued investment for the best care for our patients. With that, I'd like to turn this back to Cassie to facilitate our question and answer session.
Great. Thank you so much, Jean and Kelly, for sharing updates and telling some stories. My favorite is definitely Gilbert and all the rest of those cute all-stars. Remember, if you have a question, use the chat feature today where we have lots of time to answer all of your questions. So please use that feature. And again, if you are on the phone, there's a couple of you on the phone, feel free to reply to the email that was sent to you to register, or email me directly at cchrZan1@fairview.org. So we have a couple questions already. We'll start with one related to caring for kids. So this one's for you, Kelly. What are plans for next year's event? Will you hold it or don't you know yet?
That's a great question. And right now we do have the event scheduled. Our plan is for June 3rd and get back out to the golf course. We are looking at this every single day though, and we will see what the spring entails for our community, and we'll make the best decision, not only for the community and the sponsors and the participants, but it's really about keeping these kids safe too. And the most fun part is bringing these kids out to the golf course for everybody to meet them. And we don't want to put them in a situation where they're not comfortable.
Great, thanks. And a question for Jean. There was an announcement made by Fairview about layoffs and facility closures a couple weeks ago. Was Grand Itasca affected by those announcements?
Yeah, thanks, Cassie. As many of you might have seen in the Star Tribune and on the news, Fairview's been facing some significant financial challenges, and they are planning to close a couple of their facilities in St. Paul. Bethesda Hospital has been their COVID cohorting unit through the pandemic, and they're closing that facility. They're moving all of the COVID patients over to St. Joe's, which will also close by the end of 2021. And that has resulted in a reduction of force of about 900 people. And up to this point, Grand Itasca and Fairview Range and Hibbing have been isolated from those changes. I think we're far enough away, physically. And also, as I stated earlier, rural Minnesota has really bounced back much better than the metro hospitals have. The numbers have been higher from the start in the metro, and patients in rural Minnesota, not just in our community, but in general, have been getting back out into the facilities for care, and our volumes have bounced back almost to normal, and in some cases exceeding what we expected from our budget. So our financials, in this kind of questionable year are actually looking very positive. And therefore, we've been isolated from those changes at Fairview.
Great, thanks. Next up is a question about bed capacity. So we're hearing a lot about this and getting a lot of questions about this. And Jean mentioned that regional hospitals have been full in the recent weeks. What does this mean for Grand Itasca patients?
Sure. We're in constant communication with the facilities in Duluth, with St. Luke's and Essentia. Obviously, we send the majority of our patients to Duluth because it's closest, and our community prefers to go to Duluth. So as those facilities have been filling up, which has happened quite a few times here in the last several weeks, we are keeping more COVID patients here at Grand Itasca, which we are ready for, with some of the things that I mentioned earlier, our negative airflow rooms and our Tele-ICU capacity that just started in September. We, of course, always have the option to ship to the Metro, to mHealth Fairview facilities if we need to. We have not had to ship any COVID patients to the Metro area up to this point. So as we go through every day, we keep a check on the local bed trackers for our region in the Duluth market. So we know at any given time how many beds they have available, and if we can ship patients that way, or if we need to either keep patients here or send to the Minneapolis area.
Great, thank you. So a question about testing. I have a coworker who had known exposure to someone with COVID, but they were told they'd have to wait 5 days before they could get a test. Why is that? Jean?
Sure. This has been, I think, a frustration for some patients in the community, but the clinical science really does say that once you're exposed, you can't get tested immediately. In order for the test to work correctly, and in order for the virus to appear positive on a test, you have to wait a certain number of days after exposure. And we're following the Minnesota Department of Health guidelines on that, and I believe the communication is the same for the schools and everybody. We're all on the same page, public health, that post-exposure, you need to wait 5 days before you get tested.
Thank you. A question for Kelly. Our volunteers, are they back yet?
Oh, thanks. Great question. Our volunteers are back. Just it's only been 2-3 weeks that our volunteers have been back. It took some time to retrain all of our volunteers and give them the opportunity to once again be the friendly face at the surgery desk and the information desk here at Grand Itasca. And our gift shop is opened with limited hours and all new protocols to fit everything that's happening on our campus. But our volunteers are back, and the staff is the most excited to see all of our volunteers.
It is really nice to have them back in the building. So one more question I have so far. So if you have any questions to ask, please remember to use the chat. Let's see, PPE question. What are you short on and in need of, if anything, and is there a way for the community to help with this? Question for Jean.
Yeah, this has changed a lot throughout the course of the pandemic. Of course, originally everyone across the country was short on N95s and masks, and those supply lines have opened up a bit in recent months, which is good. We still don't have enough N95s to just have everybody wear one here all the time, and that's been a tough leadership message to enforce the rule and balance out the science and in what cases we need to wear an N95 versus letting staff wear what they feel like they need to all the time. So we do continue to have that struggle, although our supply of N95s is much greater than it was a couple months ago. So we're feeling good about that. The one area that we struggle and we wish we had more supply in is the rapid tests. So we're allocated a very small number of rapid tests for COVID at Grand Itasca. And, if you get tested with a rapid test, the result comes back in 1 hour. And we're only testing our sickest patients with those rapid tests. And it would be great if all of our tests were rapid tests. And I know the community would like that too. But this is strictly a supply issue with the labs, and I'm not sure there's much we can do about that from a community standpoint. But we're really in a much better spot supply-wise than we were a few months ago.
Great. So we had another question come in. Can you clarify how a known exposure to a COVID-19 positive person can get tested? So this is in context of somebody who does case investigation and close contacts are told they need to stay home and quarantine for 14 days. But they're wondering how they can be tested so that we can address community spread and not just ask people to quarantine exclusively.
Sure. We do test folks who have exposures and known exposures to COVID-19 positive individuals, and so you can get tested by calling Grand Itasca, and you may have to speak with a provider just to determine the exposure timeline and get your appointment that 5 days post-exposure. In those 5 days, certainly you should be staying home and in quarantine. And once you come in for a test, which will hopefully be curbside so that you're not out and about, you can do that from your car. The nurse comes right up to your car window. And I'm not sure if I'm answering the question correctly, but once the curbside swab is taken, it takes 48 to 72 hours for the result to come back. So that period, you would also need to be home and in quarantine. And it's, I think, one of the most confusing things for the community is just all of the different rules about how many days you're supposed to stay in and what those quarantine protocols are. What we have in place here for our staff at Grand Itasca is different than what another business might have for their staff. So, all of the rules are not exactly the same depending on if you're in a critical staffing shortage, if you work in a healthcare facility, if you're they might be a little more strict for the schools. So I do understand that is confusing. And our providers here are trying to stick with the standard messages, and we have tried to work with with Ascension, our other partners, Big Fork, Public Health, to try to standardize that message as much as possible. But I know that that's confusing for the community.
Great, thank you. I don't see any other questions, so we'll go ahead and wrap up. Thank you all for being with us today and for your thoughtful engagement and great questions. We know your time is precious and we appreciate you spending this time with us. We will be sending out a recording of this conversation so that you can revisit any part of it at any time. We also have a survey with some quick questions about today's event. We appreciate your feedback. You know, we're looking at this as an alternate format for future events. So we'd love to hear how this was for you as a participant. We love your open and honest feedback, and thank you in advance for that. And with that, I hope you have a wonderful rest of your day, and thank you again for joining us. Stay healthy. Goodbye.